fertility issues are a couple's problem. And it really is an issue that both partners should try to be at the first visit, because it is important that they both seek therapy together, if possible. In a standard infertility evaluation, the standard evaluation is actually a semen analysis and a hysterosalpingogram, which is an X-ray of the tubes, so that you can see that the uterine cavity is normal and that the tubes are open, because there are only three things that matter. One is that the tubes are open and that the sperm can get to the eggs. Two, that there are sperm present and those sperm are viable and healthy enough to be able to get to the eggs. And three, that ovulation is occurring. So you have to check and make sure that somebody's ovulating. If you are under the age of 35 and you've been trying to conceive for a year and you are not getting pregnant, then you should seek care. If you are over the age of 35 and you've been attempting pregnancy for 6 months and have not conceived, you should seek care as quickly as possible. Because we define infertility differently over the age of 35, because we realize that it is harder for people to get pregnant over the age of 35 because age becomes such an important factor for women. Minimal stimulation IVF is a wonderful program because it brings affordable IVF to patients. It's a wonderful program for more than one reason. It is also it's less expensive because it's fewer medications. It's less stressful because it's fewer procedures, and also because it's less expensive, it's less stressful too, because it's less burden on the patient's purse. The way minimal stimulation is performed is that you undergo some medication, but not an enormous amount of medication. And this brings down the cost enormously of the IVF cycle for patients. You then need fewer labs and fewer ultrasounds, which also brings down the time you need to spend at the doctor's office. So it's less stressful for you and having to talk to your employer about losing time from work. It's also less stressful because you do have fewer blood draws and fewer appointments, and it's fewer procedures.